Two key goals of clinical remission are for people with severe asthma to be free from exacerbations, also called asthma attacks, or the need for OCS. The full definition of clinical remission in severe asthma is currently defined as the absence of exacerbations, asthma attack, for 12 months, the absence of significant symptoms, and no use of OCS for at least 12 months. Experts also include the optimization of lung function as a fourth parameter. However, this may be difficult to achieve if there has been a delay in medical intervention, or if irreversible lung damage has accumulated after each exacerbation. For people with severe asthma, clinical remission can mean not having to experience frightening exacerbations, hospitalizations, and the side effects of OCS, which can include weight gain, anxiety, and sleep disturbances. Long-term use is also associated with an increased risk of diabetes, cataracts, and osteoporosis. Some patients have additionally reported that the emotional burden of severe asthma has reduced and that they can enjoy daily activities without debilitating symptoms. However, while remission in asthma is a step closer, it is not a cure. Some patients can only achieve remission while on treatment, and although free from exacerbations and the need for OCS, patients may still require rescue inhalers. Due to the nature of the severe asthma, even once remission has been achieved, there's a chance that a person's condition could still deteriorate over time. Preventing deterioration by reducing the risk of common infections with vaccines, or timely interventions with appropriate, evidence-based treatments, could stave off the disease progression of asthma and the early lung damage it can cause. Shelby Gorman, a GSK employee, knows all too well the negative impact of severe asthma on a child's life. Shelby's daughter, Joelle, has recently turned 18. She was diagnosed with severe asthma at aged 14. The doctor said to us, "When was the last time you had a day when you felt good all day?" Shelby says. My daughter couldn't remember. She could not remember one day when she felt well ever in her life. I think it's so important for doctors to understand that, beyond the condition, how bad severe asthma can make people feel. After many years of trying multiple different medications, and frequently being hospitalized due to exacerbations, Shelby's daughter received a more accurate diagnosis of her asthma, which identified the underlying biological cause of her asthma, and in turn led to her being started on an appropriate targeted treatment. For the first time, she was able to live her life with renewed energy and vigor. Joelle hasn't required her rescue inhaler for over a year, has not had any respiratory infections, and no longer needs to take daily antihistamines. I noticed the changes and said to my daughter, "My gosh, you just got up the stairs, and you're not out of breath," Shelby says. She would be like, "Oh yeah, oh my gosh." We would go for a little walk with the dog, and she would say, "No, I can do another lap, let's do another lap, I can do it." And then we realized